Hashimoto's, a case study here. I'm Dr. Dave Morris at Magnolia Medical Center here in Murfreesboro, Tennessee. If you want to know about Magnolia Medical Center, you can go to magnoliamedicalcenters.com and you can read all about who we are and what we do. But we are a root cause functional medicine clinic here in Middle Tennessee. I've been in practice for 28 years. We have a combined probably 100 years of natural root cause medicine between all of our providers here. We're, if not the largest, one of the largest root cause medical centers in all of Tennessee. And I'm proud to say we get some amazing results. But I wanted to tell you about a patient that came in recently. She had been to a number of doctors. Nobody could give her answers. She was doing a lot of the right things regarding diet, nutrition, exercise. And when she went to the doctors, she was having a lot of hormone symptoms. She was having a lot of gut issues, fatigue, and the doctor said nothing's wrong. And we ran some lab work and found out that she has really, really high antibodies for Hashimoto's. She had very high thyroglobulin antibodies. However, the rest of her thyroid numbers looked fine. Her blood sugar levels were fine. Her cholesterol levels, her lipid numbers were good. Her red blood cells, the quantity and quality of her red blood cells wasn't great. Her white blood cells was good. Kidney function was doing well. And so there's this one glaring outpoint on her lab work, and it was that she had really high antibodies for thyroglobulin, and that means Hashimoto's. I went online just so I could give her this information, and I just typed in really quickly symptoms related to Hashimoto's, and I wanted her to have something that was printed out, not just me spewing it out and telling her, but I printed this out, and I wanted her to see that it's an inflammatory autoimmune condition. This is what was going to happen for her. Like I told her, this is how it's going to go. I've seen this no less than 3,000 times probably. That's not an exaggeration. Where the doctors they don't do the work to find out what's going on. They never check for the antibodies unless a TSH is out. And even then, it's not even common for them to check for it, because checking for antibodies doesn't really change their treatment approach. They're still just going to prescribe the Synthroid or the levothyroxine or what have you. So they don't really want to do that. To them, it just takes more time out of their busy day to talk to the patient. They would rather just, since they're not going to change their treatment protocol, look, yeah, you might have it. Here's your medication. Go away. So what was going to happen for this lady is she was going to probably spend the next 5 years dealing with an increasing number of symptoms, her quality of life decreasing more and more, the hormone issues, the inflammatory issues, the gut issues just continuing to get worse. Because her TSH was normal, and even on our lab work, her T4 and her T3 were normal, even if the doctor checked him, he would say nothing's wrong. And it would take probably 5 years, probably 5 more different doctors, depending on how aggressive she was at looking for an answer, for somebody to even find that, or for it to show up, to start affecting her TSH levels, and then it lead to some level of treatment. So I'm just letting you know, this is a scenario where the patient goes to the doctor and the doctor says, I don't know. And that can often result in somebody being prescribed an antidepressant. It can certainly result in the patient being left feeling they've been gaslit by their doctor because they know how they feel. And it can certainly result in the patient leaving frustrated or even themselves feeling crazy because the doctor can't find anything wrong. He doesn't have an answer. So the patient leaves going, wow, maybe I am crazy. Maybe the doctor's right and there isn't anything wrong with me and it's all in my head. So you should just continue to do the digging, do your due diligence, insist on getting answers, and don't stop looking for somebody who might be able to help you unravel why you don't feel well. Symptoms are a sign that something's wrong in the body. They're a sign that something's wrong in the body. And just because somebody hasn't found it or isn't willing to look for it doesn't mean that it doesn't exist. If you want a root cause approach, you need to find a root cause doctor. A root cause approach isn't just finding the problem, it's finding out the underlying reasons why that's there and working at correcting them. That's what we do here at Magnolia Medical Center. Anyway, I hope you found this helpful. Maybe you have an anecdotal story like this and you want to leave it in the comments where you were searching for an answer and everybody kept telling you that there was nothing wrong, and you just kept looking and looking and looking until you got some answers. And then you found out what was wrong, and it was sort of shocking to you that nobody else was looking and finding those answers earlier. I'm curious about those stories. Anyway, I'm Dr. Dave Morris at Magnolia Medical Center. Have a great day.